Good evening, my world people. Welcome back to our YouTube channel. And as always, we always get education. And most of these topics we always discuss, you have given them yourselves. So if you are there watching this channel and you have a condition that has been disturbing you, be it you yourself, your parents, your sisters, your brothers, I always say that you can put it in the comment section or you can DM me direct and I will be able to discuss that topic. All these topics I'm discussing, it's you people who are giving them. We have been talking about kidney failure, the longest topic we have ever discussed. And I do appreciate, because most of the people who had requested this topic are appreciating the education they are getting from this channel. Why should you be left behind? I thank each one of you for anything, however little you are doing to push this channel ahead. For the returning subscribers, feel appreciated because this channel is growing greater because of your support. So if you are there and you are watching this channel for the first time, please take a second or two, you subscribe, and don't forget to put the notification bell on so that whenever I produce a video like this, YouTube will automatically notify you and you will never miss any of our educational bangers and you will be kept updated. We are still talking about acute tubular necrosis, and we were talking about who were at risk for acute tubular necrosis. Which age group is at risk for acute tubular necrosis? We discussed the first and second in our previous video, and the third one is what we call septic shock. When you see the word septic, it simply means an infection. So, septic shock. Sepsis can cause a drastic drop in your blood pressure and slow blood circulation to your kidneys. Get this very clearly. Sepsis, which is an infection, can cause a drastic drop in your blood pressure, or what we call hypotension, and slow blood circulation to your kidneys. Definitely you know what will happen if there is no enough supply of blood in your kidneys. The kidneys will lack oxygen. So, sepsis can cause a drastic drop in your blood pressure and slow blood circulation into your kidneys. This is very dangerous if you already have low blood pressure problems. This is very dangerous if you already have low blood pressure problems. Number 4, a major surgical procedure. A major surgical procedure. Surgical means something that is invasive. So this can cause complications with your blood supply or circulation. A major surgical procedure. This can cause complications with your blood supply or circulation. Let's talk about diagnosis of acute tubular necrosis. How will you diagnose? How will you tell that somebody is having acute tubular necrosis? If your doctor suspects acute tubular necrosis, they may order specific diagnostic tests. Get this very clearly. Diagnosis of acute tubular necrosis. If your doctor suspects that you have acute tubular necrosis, they may order specific diagnostic tests, including the following. What diagnostic tests can aid you to diagnose acute necrosis? What tests can you order, or what tests can a doctor order so that they may aid him or her in diagnosing acute tubular necrosis? If your doctor suspects acute tubular necrosis, they may order specific diagnostic tests as following. Number one, urinalysis. Each one of us understands what urinalysis is. This is just an analysis of your urine, a critical analysis of your urine. So, to look for abnormal cells in your urine, the color of the urine and signs of infection from bacteria and other organisms. So the doctor will order for urinalysis to look for abnormal cells in your urine, the color of the urine, and signs of infection from bacteria and other organisms. I hope you get that about urinalysis, that the doctor will order urinalysis to look for abnormal cells in your urine, the color of the urine, and signs of infection from bacteria and other organisms. Bacteria are not the only microorganisms we have. You may also have fungus, which can also cause urinary tract infections. So, number two, BUN. BUN. BUN and creatinine urine tests. We talked about BUN, blood urea nitrogen, and creatinine urine. Tests since both levels increase with kidney failure. So BUN and creatinine urine can always go up if your kidneys are failing, because these toxic substances are always eliminated by the kidneys. So if you find that the BUN and creatinine urine levels are going up, this is an indicator that the kidneys are failing or the kidneys are having a problem. Number three, we have biopsy to examine your kidney tissue. Biopsy is whereby a small piece of the affected kidney can be removed surgically, taken to the laboratory to detect if the kidney tissue may be having cancer cells. So biopsy to examine your kidney tissue. Number four, we have blood tests. Blood tests to measure sodium and creatinine. These are always eliminated by the kidneys. So if they are found there in the blood, it will mean that there is a problem in your kidneys. So blood tests to measure sodium and creatinine. Number five, we have CT scans of the inside of your kidneys. CT scan. CT scans of the inside of your kidneys. Remember, CT scan is more detailed. So if you do a CT scan of the inside of your kidneys, it will give finer details about the kidney tubules. And if there is a problem, we'll be in a position to diagnose acute tubular necrosis. So after diagnosing, what's next? If you go to an hospital, you are taken to lab and a diagnosis is made, or the doctor gets to know what you are suffering from, the next step is treatment. So let's talk about treating acute tubular necrosis. Treating acute tubular necrosis. Your doctor may prescribe medication to decrease the fluid and waste buildup in your kidneys. Remember, these kidneys are not functioning well. So definitely there will be fluid buildup in your kidneys and waste build up, for example, creatinine. So, your doctor may prescribe medication to decrease the fluid and waste build up in your kidneys. You may also be told to restrict your diet to reduce your intake of sodium and potassium. Very important. Your doctor may prescribe medication to decrease the fluid and waste buildup in your kidneys. You may also be told to restrict your diet to reduce your intake of sodium and potassium. Sodium is always contained in the usual salt we use in our foods. So, you may also be told to restrict your diet to reduce your intake of sodium and potassium. You will need to regulate the amount of water you drink to avoid excess fluid retention. Remember, your kidneys are not functioning well and they assist in eliminating the excess fluids. So in this case, your doctor may advise you to regulate the amount of water you drink to avoid excess fluid retention. Too much fluid can lead to abnormal swelling in your arms, legs, and feet. This is very important that you will need to regulate the amount of water you drink to avoid excess fluid retention. Too much fluid can lead to abnormal swelling in your arms, legs, and feet. A point to note, depending on your condition, dialysis could be another treatment option. This is very important. Depending on your condition, dialysis could be another option for treatment, or dialysis can be another treatment option. This procedure or dialysis helps your kidneys to filter excess fluids and wastes. Depending on your condition, dialysis could be another treatment option. This procedure helps your kidneys filter excess fluids and wastes. Another point to note, acute kidney failure is reversible depending on your health, and if you don't have underlying conditions and started treatment in early stages of the condition. This is very important that acute kidney failure is reversible depending on your health and if you don't have underlying conditions and you started treatment in early stages of the condition. That's why we have talked about the early diagnosis and the early treatment. This explains that point. My people, this marks the end of our video today. Thank you for the time you have given me. Thank you for the subscriptions. Those who are sharing the videos, I also appreciate you. And also the comments. We can't also forget to appreciate you who are giving topics for them to be discussed. You are part and parcel of this big family. So let's continue subscribing and encouraging our brothers and sisters to support this channel and benefit from it. Let's have a wonderful day ahead.